Boundaries in recovery are not about punishment. They are about survival. Addiction thrives when everyone around it keeps adjusting, covering, lying, and cleaning up the damage. The moment healthy boundaries appear, the entire system changes, and that's often when recovery finally becomes possible. One of the hardest truths about addiction is that loved ones can accidentally help keep it alive. Family members often cover for missed work, lie to protect the addict, hand over money, or avoid confrontation just to keep the peace. But according to recovery experts, addicts thrive in secrecy and avoidance. When there are no consequences, there is very little reason to change. That is why boundaries matter so much. A healthy boundary might sound like, no drugs or alcohol in this house, or even, if you lose your job because of substance use, we will not financially support the addiction. These boundaries are not revenge. They are meant to stop enabling destructive behavior. And setting boundaries is incredibly difficult. Many loved ones become codependent without realizing it. They become trapped in people-pleasing, terrified that enforcing rules will push the addict deeper into substance abuse. But research and clinical experience show the opposite is often true. Boundaries create accountability, which creates space for recovery. The problem is that addicts frequently push back hard when boundaries first appear. They may test limits, manipulate emotionally, or insist loved ones are being cruel. That reaction is common because addiction depends on predictability and control. Experts recommend approaching boundaries calmly and clearly. Have a neutral conversation. State the behavior that cannot continue. Explain the consequence immediately and specifically. Stay firm without turning the situation into a fight. The goal is protection, not punishment. Healthy boundaries can protect everyone involved. They reduce manipulation, chaos, and emotional burnout inside families affected by addiction. Avenues Recovery works with both individuals and families because addiction rarely affects just one person. Recovery often begins when the unhealthy patterns surrounding addiction finally stop.